The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. My name is Beth Schaffner. I'm the director of the RSA Shift Transition Project at Peak Parent Center. Welcome to today's webinar, which is Navigating Systems Social Security Benefits. And I want to give you a few logistical details before we get started, and I introduce the interface or control panel in the upper right-hand corner of your computer's desktop. By default, you are listening into today's webinar using your computer's speaker system. If you would prefer to join over the phone, just select telephone. One will remain muted. Participants will remain muted during this webinar. We do want to give you, and we'll give you the opportunity to submit text questions to our presenter today by typing your questions into the question panel of the control panel. You can send your questions in at any time during the presentation. However, we are allotting a 10 to 15 minute time period after Kelly's presentation when she will respond to your questions. And the handouts are available today. There are 5 handouts that you can download to your computer that are in the handout window. We are also sending some additional handouts, emailing them to you. Our platform wasn't able to accept all of the handouts that Kelly is providing for us today. So we will be emailing you to everyone who is registered for this webinar, the additional handouts. As you leave today's webinar, you will receive an evaluation survey about the presentation, and we would appreciate if you would take a minute to complete that and give us your feedback. You will also receive a follow-up email very soon with a link to viewing a recording of today's webinar. So again, welcome to the webinar, Navigating Systems Social Security Benefits. It is my pleasure to introduce Kelly Land. Kelly works for the Center on Community Living and Careers at Indiana University as the project coordinator. She's worked in the human service field for over 12 years. Her experience includes management, transition services, benefits counseling, and program implementation. She received her bachelor's degree in business management and completed her master's degree in public affairs with a concentration on human resources from Indiana Wesleyan University. She is certified through Virginia Commonwealth University as a community work incentives coordinator, serves on the National APSE board, and on several state work groups for the APSE project. And Kelly holds a strong belief that all individuals should be empowered to live meaningful and successful lives within their communities. We're very, very pleased to have the opportunity to bring Kelly to you today, and I want to turn this over to her. Kelly, thank you very much for joining us. And just quickly before you take over, Kelly, I want to also mention that if you have any technical difficulties with the webinar today, especially with hearing and seeing the screen, please type that into the chat window, and we have a technical assistance person who is ready to help you with that as well. So remember to use the questions box for your questions, and then also let us know if you're having any technical issues. And Kelly, I'm going to turn this over to you. Thank you.
Thank you so much, Beth, and thank you for having me. I hope everybody can hear me okay. And as Beth said, my name is Kelly Land, and I have been um, doing exciting things with benefits for over 12 years now. So super excited to bring this information to you. And I am one of those benefit geeks that think all this stuff is very exciting, and it opens up a wide their way off benefits. So thank you so much for having me, and let's go ahead and get into the materials. Maybe if my slides move. So we're first going to start today with what type of benefits there are. I think there's a lot of confusion with parents and families about what type of benefits my child receives and why do they receive those kind of benefits. The first benefits we're going to talk about today are the children benefits for individuals that are under the age of 18. So a child can receive various types of benefits from Social Security, and these benefits do not always have to be based on the child's disability. A child who's under the age of 18 or 19 if still in high school may receive benefit payments from Social Security simply because they're a dependent of a parent who's disabled, retired, or deceased. These benefits are paid off the parent's work record. If a child has been receiving Social Security benefits and they end because they turn 18 or 19 if still in high school, he or she can apply for benefits based on his or her own disability. This disability has to be severe and likely to interfere with his or her ability to work at a self-sufficient level. Another type of benefit is the Social Security Disability Benefit, or also known as Title II, or in our world, a lot of times we call it the SSDI program. It is a disability insurance program, meaning that someone has paid into the system for this program or someone responsible for you has paid into this program. If a child is disabled before the age of 22 and has a parent who is deceased, disabled, or retired, he or she may receive childhood disability benefits, or we also call those CDB, or sometimes you'll hear them referred to as DAC, Disabled Adult Child. And that would be based on the work record of the parent. If a student has worked, he or she may also receive SSDI benefits based on their own work history or earnings. After 24 months of receiving that SSDI entitlement, you then would begin to receive Medicare benefits. And that's the health insurance that comes from the national database from that. And we can talk about that here in a little bit in more detail. The other benefit that a lot of people know about is called the Supplemental Security Income, or SSI. It is also known as Title 16. As you can tell, we have lots of acronyms in these services, and so I like to let parents and families and individuals know that you might hear these named all sorts of different things depending on who you talk to. So, and I can also provide at a different time, if Beth would like, an acronym list of some acronyms that you'll hear most often when you're working with the Social Security system. SSI, or Supplemental Security Income, is based on a need. They look at a resource limit, and they also look at the income wages that you're receiving. The resource limit at a federal level is $2,000 per month, and that would include any bank accounts and any assets that you can convert into cash. It does not include one car per household or a home that an individual lives in, though. If under age 18, a child must be medically disabled by Social Security standards, and both a child and family's income and resources have to be below certain limits. Once a child turns 18, income of the parents are no longer considered, but the child must meet the medical requirements for an adult with a disability. SSI benefit amount may differ depending on the person's living arrangements. The maximum level that you can get, or a maximum amount that you can receive from SSI, is $750 in 2018. Typically, that amount increases each year, but it just depends. I don't want to say it always increases. We had a few years where it kind of plateaued and stayed the same level. We learn that every year in October by the cost of living adjustment that comes out to know what it's going to be for the next year. Individuals who receive SSI benefits automatically receive Medicaid insurance. Once again, we'll talk about insurance briefly later on in this presentation. So how do we apply for benefits? Let's get into that. There's 3 different ways that you can apply for benefits. You can apply at the nearest Social Security field office in person, or you can call the Social Security toll-free number to make an appointment to file a disability claim at the local Social Security office, or to set up an appointment for someone to take the disability claim over the phone. You can also initiate an online application by visiting the Social Security website that I have listed for you in this PowerPoint. Social Security does encourage online applications. I would suggest that you could always start the application online. It's about 5 screens of information, and then you can always click if you want the follow-up appointment to either be by phone or in person. I always think it's best to do those in person. It seems like the phone calls sometimes can get confusing. They ask a lot of different questions. So from all my years of experience, I would recommend starting online and then requesting an appointment in person. One thing I really want to talk about is the age 18 redetermination. There's a lot of confusion around this. As most of you know, when a child turns 18 in the United States, they are automatically an adult. And this does not matter how severe their disability is. It also doesn't matter if they have a guardian or a payee at the Social Security system. So at age 18, or at least between the 18th and 19th birthday of an individual, of a child who now became an adult, they will have to reapply for Social Security benefits. So even if they were receiving SSI or were receiving SSDI, they will have to reapply as an adult between their 18th and 19th birthday. The adult SSI, Supplemental Security Income, the adult benefit that you would receive is more stringent than the child test. So just know that you could receive benefits as a child, or your child could be receiving those. And as an adult, they are denied due to that the severity level is more stringent as an adult. However, the parent's income no longer applies. So if you were denied Social Security benefits or SSI benefits for your child due to your income, once the child becomes an adult, then the parent's income no longer applies. They will still look at what bills are paid in the household by the parent if the child still lives within the home, but they will not look at the actual wages that the parent is earning. Those who no longer qualified medically may be able to continue receiving SSI benefits temporarily if they're participating in a vocational rehabilitation program, and that is called Section 301. The reason that I also bring this up and kind of pause on this slide for you, for the parents and the individuals listening to this webinar, is because another thing that typically occurs when an individual turns 18 in high school, if they are in a life skills program or in a transition service program, typically they're going to go to work for the first time. And so they will receive their first paycheck at the same time that they're turning age 18. And what I would like parents to know and individuals is that if the child's benefit ceases at the age of 19, it's not due to the working income, it's due to this age 18 redetermination. So please just remember that you will need to reapply for benefits between the ages of 18 and 19 for your child, or you also can begin applying for benefits if you were denied in the past due to income for your child who has now become a legal adult. Supplemental security, income, and work. So let's talk about how those two work together. I first want to talk about the federal benefit rate. I mentioned it earlier, but the federal benefit monthly amount typically changes in January of each year, and it is the highest federal payment an individual or an eligible couple may receive. An eligible couple, just to point on that real quick, is two beneficiaries that are both receiving SSI benefits. An individual's maximum amount that they are paid would be $750 per month. The maximum amount that a couple could receive is $1,125 per month. Please remember that this is called a supplemental security income. This amount of money is supposed to pay for housing, food, and shelter. So the $750 is not meant to pay for all bills that come into the household. It is meant to supplement income and help pay for food and shelter only. Now, how do they calculate a person's SSI payment? When Social Security is deciding how much an SSI person should receive, they look at other income the person may have. So remember, I said this is a means-tested program. So they're going to look at any income that comes into the household, as well as any working wages that are coming in. So any other income that would not come from working wages is called unearned income. And some examples of this would be unemployment benefits, child support, or SSDI. Sometimes people are receiving an SSDI benefit off of a parent, as well as SSI. They also will look at earned income, and this is any wages from work or income from self-employment. When they are calculating a person's SSI payment, they exclude or do not count the first $20 of a person's unearned income. This is called the general income exclusion. They also exclude the first $65 and half of the remainder of the person's earned income. This is called the earned income exclusion. So that paragraph that I just read to you guys, I'm not sure if you can see my mouse, but this paragraph that I just read to you guys, everyone receives that as exclusion. So that it does not matter on your disability or how much money you're earning. Everyone gets the first $20 of their unearned income disregarded. The first $65 of their earned income is disregarded, and then that is divided by 2. I'm going to show you guys a quick Excel spreadsheet on how Social Security looks at this. You'll see that step 1 is unearned income, and that's where they take that $20 exclusion. Step 2 is earned income, and that's where they take that $65 exclusion. And then they divide that by 2. So I have all those pointed out for you. As well as in the handouts, and you'll also receive by email, Beth will send you guys some examples of a person who is working without any work incentives and how their SSI check will look at the end of the month, as well as all the work incentives that we're about to talk about. So not only do you get all those exclusions I just talked about, but they also allow you to have additional work incentives available to kind of calculate your earned income, or they call it countable earned income. So Social Security does not count all of your earned income. A person can earn $500 a month, but Social Security may only be counting $100 of that, depending on what other supports you need while you're working. The first work incentive that is available is called a Student Earned Income Exclusion. And this special exclusion is for students who are under the age of 22 and regularly attending high school or college. This could also be a training program to prepare them for employment. This will allow them to keep all or most of their SSI payment while they work. The reason for this is so that as a young adult, people can go out and work and not worry about what's going to happen to my Social Security benefit. Social Security and the federal government wants you to go try work without having those fears, especially as a young adult. There is a new revision. So not only will they look at you regularly attending high school or college, they'll also look at some online school. An online school is one that offers internet-based courses to students. In 2018, Social Security will allow a qualifying student, so qualifying student would be under the age of 22 and regularly attending high school or college or an online school. And you would be able to earn up to $1,820 per month or up to the limit of $7,350 per year before your wages have an impact on your SSI payment. So just to reiterate that, a person can earn up to $1,820 per month or to a limit of $7,350 per year before their SSI payments would ever be impacted. I also show an example of this in the countable income formula examples that I sent to Beth that are also in your handouts. There's also an impairment-related work expense. Social Security understands that some individuals may have out-of-pocket expenses for items or services they need in order to work, such as medications or medical equipment. So let's be honest. I think we all have things that we have to do as individuals to be able to get to work. That might include paying for transportation. That might include having to take certain medications so that we're able to be the best that we can be at work. And Social Security recognizes that people that are on Social Security benefits or on SSI benefits also have these expenses. Social Security may subtract these expenses from your gross wages after the $85 is deducted. So remember, I told you that you get $20 deducted from your unearned, $65 deducted from your earned. And then on top of that, Social Security will also, or may also, subtract these expenses, such as your medication cost, medical equipment, or transportation cost, as well from your gross earned income. This results in a lower countable earned income, which results in a higher SSI payment. You do have to show Social Security receipts for these items, and Social Security must approve them. Other examples may include co-payments for medications, medical equipment, doctor's visits, counseling appointments that you have to pay for out of pocket, physical or occupational or speech therapy appointments that you may have to pay co-pays for out of pocket, medical supplies, or special transportation. You do have to pay for all of these out of pocket. These cannot be reimbursed by Medicaid waiver services or by vocational rehabilitation services. So these are fees that you're paying out of pocket. You keep those receipts and turn those into Social Security for approval. As well, I also have an example of this in the countable income sheets in your handouts. Let's talk about individuals who are statutory blind under the Social Security system. If somebody is considered statutory blind through Social Security, so remember, that doesn't mean that we believe somebody is blind. A lot of times, somebody will come in with a seeing eye dog or your eye doctor has told you that you're statutory blind, we do need to make sure that that's verified through the Social Security system before we begin looking into blind work expenses. But if you know that you are receiving a benefit through Social Security as a statutory blind individual, then you can look into a blind work expense, or we also call this a BWE. Social Security has special rules for people who have statutory blindness. Instead of deducting for impairment-related work expenses, they'll deduct for expenses a blind person has due to work. So the difference here is that an impairment-related work expense has to be related to the disability that the individual has, and you have to need it for work. For a blind work expense, this can be any expenses that a person has due to work. So some examples might be state and federal taxes, union dues if they're mandatory to be paid, any uniforms that you need for work, driver's services to get you to work, any childcare costs that you pay, cost of a service animal, transportation cost, or any reader services cost. And these are just examples. There are lists and lists of other things that you may have to pay as a statutory blind individual due to go to work. Finally, another work incentive that's available is called a Plan for Achieving Self-Support, or a PASS, P-A-S-S. This means that you can set aside income or resources for a specified period of time in order to pay for items or services needed to achieve a specific work goal. Typically, a PASS lasts 18 to 48 months. Social Security may allow you to set aside funds such as unearned income or countable earnings or resources to help you achieve your goal. Since these funds will not be counted, a PASS may allow you to become eligible for SSI and Medicaid, or it may increase the amount of your SSI payment. An example of this would be if a person needs to set aside money for a laptop for them to complete their college courses that will then allow them to go out and achieve their vocational goal. You also could set aside funds to start your own small business. Those are just a few examples. If you can talk to Social Security and if you set aside those funds for something that will allow you to be successful in your vocational goal and you're willing to work through the PASS cadre, then you may be able to set aside those funds and increase your SSI payment amount each month. I have included in here the phone number for the PASS cadre, as well as the Social Security website to learn more information. Just a few things to remember when we're talking about supplemental security income. If you lose your job, you simply contact your Social Security office and let them know. You will be asked to supply a letter from your employer stating the date that your job terminated or ended. If you are no longer receiving a check, you may need to contact Social Security for an updated medical review. However, provisional payments are usually awarded while a medical redetermination is being conducted. Always report your income to Social Security, regardless of the amount each month. I'm going to repeat that again. Make sure at the end of the month you always report any type of earned income or unearned income that you have received that month, regardless of the amount. Report any changes in resources, income, and living arrangements to the Social Security Administration. Let's now move into Social Security disability insurance and work. How do those work together? They are two completely different systems. So please remember that when you're looking into work incentives, you're looking into the SSI system's work incentives or the SSI SSDI system, depending on what benefit you're receiving through the Social Security system. SSDI works a little bit different than SSI. SSDI works through a timeline. So when you begin work, the first timeline that you're going to reach is called a trial work period. Most beneficiaries are entitled to 9 trial work months. This is exactly what it means. Just go try work. You'll get your full SSDI or CDB payment during your trial work period, regardless of how much you earn. In 2018, you have to earn at least $850 in gross wages in 1 month before that month will even be counted as a trial work month. So again, you get 9 trial work months, you receive your entire SSDI check, and it doesn't even count a trial work period month until you earn $850 in gross wages. Now, typically that trial work period amount increases each year. Again, that comes out in the cost of living adjustment that we typically receive in October. Trial work months are not required to be consecutive months. So you may go to work for 3 months and then decide that you are not able to do that job on an ongoing basis. So you have to terminate that position. And maybe in 4 months later, you get another job, and then they can count a trial work period. So you can be working your trial work months sporadically, and they look at it over a rolling 60-month period. Really, what I want you guys to know off of this slide is if you're on SSDI and you've never worked before, go try work. You have 9 trial work months that you're able to try work, and you do not have to be at risk of losing your SSDI check at that time.
Kelly, this is Beth. If I could just interrupt for a minute, there's a couple of, I think, quick questions that relate specifically to this.
Okay.
One of them is, do you need to report any cash gifts received, like for birthday or Christmas?
So that would be on the SSI side. Gifts are not counted as a resource or as income. So you would not have to. Now, what I would suggest, just because I never want anyone to be put into a position where that money goes into their bank account. So if you get a very large amount, you get let's say at Christmas time, you get $600 and you put that money into your bank account. At the end of the month, if that bank account pushes your resources over that $2,000 limit, then that will then count as a resource. So it won't count as income, but it could count as a resource. I hope that answers that question.
Thank you. And then the other question is, what if an employer refuses to provide an employee with a letter noting when their job ended?
Yeah, if that is an issue, and I know that has been an issue at certain times, I would say the first thing you want to do then is just provide your paycheck stub. So the last paycheck stub that you receive, make sure that you turn that into Social Security, and then make sure that you print out a letter that just says, this is the last paycheck stub that I received. This is the day that I terminated from my employer. And it's all going to kind of come down to who the Social Security office is, but you can only provide as much as is available to you.
Thank you. That's it for now.
Okay, great. All right, so we just got done talking about the trial work period level. Now, once your trial work period months have been completed, Social Security is going to begin to look at a thing called substantial gainful activity. Each year, Social Security uses earnings or guidelines when they are deciding whether or not your earnings show substantial gainful activity. In 2018, the SGA guideline is $1,180 or $1,970 for a person that is statutory blind in gross monthly earnings. This is typically the amount that I get asked about from parents or individuals. How much can I earn before I'll lose my benefits? And I'll be really honest with you guys, I don't like giving this amount. I feel like that if we tell somebody right now that you can't earn more than $1,180, then in 20 years, they're still going to believe that they can't earn more than $1,180. What I want everyone to understand is that this is a guideline. This amount also increases typically every year in that cost of living adjustment that I keep mentioning. So I hate to give people a concrete number. SGA is not simply a number. It's an objective dollar amount that Social Security establishes each year as the upper limit that a beneficiary can earn before benefits have ended or are ended. Social Security determinations requires that Social Security personnel gather the applicable facts and apply the appropriate rules and procedures and use their best judgment when they're rendering a decision about the value of an individual's work. So just like we talked about in SSI, how there's all those work incentives and all those exclusions that can lower a person's countable income, the same thing happens in the SSDI system. There are additional work incentives that you are able to use that will reduce your gross wages that Social Security won't count as your earned income. Some of those work incentives include subsidies or special conditions. And what this means is that Social Security recognizes that sometimes a person's disability results in the need for extra assistance, a reduced production rate, frequent breaks, or fewer job duties than a coworker in a similar job. These would be called accommodations. And I think we all have accommodations, just like we all have things we have to pay for to get to work. So Social Security understands that. And if, let's say you have a job coach that goes into work with you and helps you clock in every day or every shift, then that would be considered a special condition. There's also impairment-related work expenses under the SSDI system. So that should sound familiar. We just talked about that under the SSI system. If the beneficiary is paying for something out of pocket that relates to their disability and work, such as medication expenses, that can be considered an IRWE. So let's say that someone earns $500 from work. Well, we'll go above the SGA level. Let's say somebody is receiving $2,000 in income from work. If they pay $200 in medication expenses, then Social Security will only count $1,800. Am I saying that right? Yeah, $1,800 as working income because $200 of that is going to be excluded. These incentives do not really exist until Social Security says that they exist. So you do have to turn in these receipts. You do have to turn in information explaining what the subsidy and special condition is, and you do have to have approval for that before Social Security will apply those to your gross wages. There's also the expedient reinstatement of benefits. This is when your benefits are terminated, not suspended. So you've completely worked your way off your benefits. You're working full time, you're doing great. However, if your work activity falls below that substantial gainful activity amount within 60 months of termination, so you have 5 years, so your benefits are terminated due to work, and within that 60 months, if for some reason your work activity falls below that substantial gainful activity amount, or you reduce your work, or your job is lost due to the same disability or impairment related to your original disability benefit, then all you have to do is contact Social Security, fill out a shorter application, and you will receive 6 months of provisional benefits while they do a new medical redetermination. So I want people to kind of, hopefully these 3 work incentives that I've talked to you about under the SSDI system have kind of reduced your fear of what happens if I go to work and will I lose my Social Security disability benefit. Beth, we're going to move into health insurance, just a few brief slides. Is there any questions around the work incentives for SSI or SSDI at this time?
I don't see any additional questions here. Maybe we should allow a minute for folks to think about that and add in if they have a question.
Okay, great. I'm going to go ahead and move on for time reasons. Okay, let's just briefly talk about health insurance. I'm not going to get into this too much. You guys are going to have a wonderful webinar put on by the Medicaid office, I believe here in a couple weeks. So I just want to mention a few things that are really important. First, to talk about Medicare. We mentioned earlier that you receive Medicare benefits for after you've received SSDI benefits for 24 months. Medicare is the country's health insurance program that certain people with disabilities who have received SSDI for 24 months can begin receiving. It provides basic protection against the cost of health care, but it does not cover all the medical expenses or the cost of most long-term care. It typically is an 80-20 split. There are 2 main parts to Medicare. There's Medicare Part A, also known as hospital insurance, or sometimes you'll hear it called HI. It helps pay for care in a hospital and skilled nursing facilities, home health care, and or hospice care. There's also Medicare Part B, also known as Supplemental Medical Insurance, or SMI. And this helps pay for medical doctors, outpatient hospital care, and other medical services. Typically with Medicare Part B, you do have a cost with that. If you do not receive Medicaid insurance, you will have a cost of Medicare Part B of $134 per month. There is a work incentive that goes along with Medicare. It's called Extended Period of Medicare Coverage. It protects your Medicare coverage for at least 93 months after you complete your trial work period. So if you go back to work, or if you go to work and you complete that 9 months of your trial work period, from that time, if you've worked your way off benefits, you will have 93 months, or I believe that's like a little bit over 7 years, before you would have to be at risk of losing your Medicare Part A insurance. During this extended Medicare coverage, you do receive Part A premium-free hospital insurance, and you would get Part B elected medical insurance coverage, but you would have that monthly premium. You could also elect to get the Medicare prescription drug coverage if applicable, and that is called the Medicare Part D, as in dog insurance. Exactly when the extended Medicare coverage begins and ends is determined by when you consistently reach SGA, or substantial gainful activity. Please remember that word, consistently. I think the thing I want you to remember on this is that you don't have to fear for losing your Medicare insurance if you begin to work your way off your SSDI benefits. You can also contact SHIP, or SHIP. It helps beneficiaries make informed choices about their Medicare. And I did put the local SHIP website for you guys for all the Coloradians that are listening into this call.
Kelly, may I ask, what does SHIP stand for?
It is the State Health Insurance Program, or partners. It's either program or partners. Sorry, there's so many acronyms.
Yeah. Thanks.
You're welcome. And then I'll just briefly talk about Medicaid, because you guys are going to get wonderful information on this. But Medicaid is, in Colorado, the health Health First Colorado, Colorado's Medicaid program. It's a public health insurance for Coloradans who qualify. Health First Colorado is funded jointly by federal, state partnership and is administered by the Department of Healthcare Policy and Financing. As I said, Colorado is a 1634 state, and that means a person is eligible for, if they're eligible for SSI, they're automatically eligible for Medicaid. In our world, we don't typically say automatic, so it's nice here that you do automatically, you're automatically eligible for Medicaid. And there's no longer a separate determination process. Now, please remember I use the word automatically eligible, not automatically receiving, because they are going to look at those resource levels of that $2,000 and the disability for the individual before you would actually have access to your Medicaid. Remember, the Medicaid resource limit is the same as SSI at $2,000 or $3,000 if you're a couple. And I also put the Colorado Medicaid website here for you. Beth, if we have time and we don't have questions, I can go ahead and go into asset building, but if there's additional questions, I am free to answer those now.
I do have one more question that has come in. If the student is 18 and unable to do so themselves, can a guardian do it for them?
I would assume they mean apply for them?
I believe so. And maybe that person can clarify if that's not the case. Oh, she says, yes, that is.
Okay.
Yes.
Yeah. So if your guardian and or well, I guess you wouldn't be payee yet because you have to apply for the benefits. But yeah, if you're guardian, you can help that person. To be honest, when I was a job coach, when I was a director of a program, I helped people apply for those benefits. So please, as an advocate, as a parent, help people apply for those benefits because it is a very difficult process. And I think everybody can use, as much help as possible to navigate the Social Security system, and that way that they feel secure and then are able to pursue employment if they feel that that's their next step.
Thank you. Another question now. Does the Medicaid training you are referencing include information about Medicaid buy-in and how best to apply? And because I was actually going to ask you to at least reference Medicaid buy-in, Kelly, but we're hoping that our speaker will also reference Medicaid buy-in. It certainly is an important component, and we will make sure that our speaker coming up in the next webinar does that. But can you just very quickly, Kelly, talk about in general what Medicaid buy-in means?
Yeah, I would love to. I don't want to get too much into detail with specifically how Colorado looks at Medicaid buy-in, but Medicaid buy-in is a fabulous program. For those of you on the call that do not know what that is, Medicaid buy-in allows a person with a disability to go to work and then purchase Medicaid insurance with a small premium. So typically this would be for a person that is on Social Security disability benefits, and maybe they have Medicaid insurance that allows them to access their Medicaid waivers or allows them to access additional healthcare insurance that maybe helps pay for those copays, or that Part B insurance through their Social Security disability or through their Medicare insurance. And so Medicaid buy-in, since that person on SSDI would not automatically be eligible for Medicaid, they could go and say, I'm interested in your Medicaid buy-in program. And as long as you need Medicaid to work and you still meet the disability definition under the Social Security system and the Medicaid system, as well as you have your resources below those $2,000 and $3,000, then you should be applicable to apply for a Medicaid buy-in and then pay a small premium to continue that. And I really do mean small. They start anywhere from about $48 and can go up to about $168 a month. But if you have high medical costs, it's a very small fee to pay, or if you are on the Medicaid waivers, as you know, those resources that you get from a Medicaid waiver sometimes are we can't even put a value on those for how much they do for our families and for our self-sufficiency as an individual. I hope that answered that, Beth, with very generalization.
Yes, thank you. And we will be addressing that as well, as I said, at our next webinar. Kelly, another question. I think maybe the person who had asked this earlier and maybe needed a little more clarification on reporting to Social Security when you receive a cash gift. Could you just clarify that for us? There's an amount limit for that. Is that correct?
No, a gift is not going to be considered as income. So as long as it's a gift, it's not to pay your food or shelter, and you did not do anything, it's not working wages. So you didn't mow someone's lawn, you didn't walk someone's dog. It's not a gift that says, here, I'm giving you this gift to pay your rent for that month. Then it is excluded. It's not considered income. It doesn't have to be reported. Just as I said, you want to make sure that, it will be considered a resource, though, once it is deposited into a bank account or you have it as cash value.
Okay, thanks. And to continue with that question for more clarification, this parent says she had to meet with Social Security for 4 hours and her child's benefits were decreased for 4 months. Is that related to the receiving the gift, or is this a different question, if I could ask that person? Related to the gift, she says.
And unfortunately, I, without knowing more about the case, it's really hard for me to answer that, as well as I'm not Social Security. So, Social Security representatives sometimes, make decisions based on the information that they're given without, and I don't want you to have to get too personal on this. We can definitely, my email will be at the end of this and you can contact me and we can talk about it more depending on how much the gift was and depending on if it was used towards food or shelter, as well as, did it put you over resources and bank accounts? All that could go into that factor. All I can really give you is what, the Social Security policy is on what an actual gift would be considered for an individual. And okay. I can obviously provide, the policy, the Social Security policy for that. And I can send that to you, Beth, if you would like to as well send that out with our handouts.
Oh, that would be great, Kelly. Thanks.
Uh-huh.
And, the parent just said thank you for the information. I have a couple more questions here now. Are the handouts available in Spanish?
I do not have these specifically available in Spanish. However, there is the Social Security Red Book, which explains all of the work incentives that I'm explaining to you, and that does come in Spanish. So I also can include that link if you would like, Beth, with the additional resources that I sent to you.
Great, thank you. And then someone is asking, can we obtain a copy of this webinar? We are recording the webinar today. You will receive a link to the recording in our follow-up email to you. You also, I've neglected to mention earlier that in the handouts that you can download, there is a PDF document of the slides Kelly is using today to give you this information, which I think are very informative, Kelly. Thank you. And so you'll have that, as well as the additional handouts Kelly's been mentioning. We'll send those to you. And we don't have any other questions right now, Kelly, except a thanks, another thanks to you. We've got about 6 minutes left. I don't know. I know you had some additional information. Is there something you can add in maybe 3 minutes or so time? I do need a couple of minutes right at the end for an announcement.
Yeah, let me just quickly, you guys are going to have the slides as well as fact sheets on these. You know, something really close to my heart is that I feel that sometimes individuals, families, individuals with disabilities don't feel that they're able to save money. And that is a huge myth and misconception out there in our society. And it's understandably why, because I just told you all that information and it's hard to understand everything. And so I just want to hit on a few things. There are two very important accounts that people can save money in that will not affect your Social Security benefits or your resource levels. One is called an individual development account. This is a match funding system that's four times the size of each deposit. So somebody deposits $25 and then they're matched with $100 from the state on that up to $4,000. You can use this for saving for a first home, starting a business, educational cost, and also a vehicle to get you to and from either work or school. The individual does have to be employed, have income less than 200% of the federal poverty level, which is right around $24,000 a year, and be willing to participate in financial education classes. I know I went through that really quick. As I said, there's a fact sheet that Beth will also be sending to you. And then I've included in the PowerPoint as well the links for the Colorado IDA providers. And then I'm sure most of you know about this, but I would not be doing my job if I don't tell you about the amazing accounts out there called ABLE accounts, which are the Achieving a Better Life Experience accounts. They offer certain individuals with disabilities the opportunity to save money for qualified disability expenses without losing the eligibility for Medicaid or Social Security benefits. It is a tax advantage similar to a 529 plan. You do get to control your own money. You can save up to $15,000 per year in 2018. It just helps people increase their personal responsibility and choice. And in Colorado, yours is called Colorado ABLE. I provide the website for you guys, and you guys can learn a lot more about there. It's very cost effective to set up the account, as well as super user friendly on the website. So those are really the two main things, Beth, I wanted to talk about, and hopefully that was in 3 minutes. And then here's all my contact information. If you guys have additional questions, please feel free to reach out to me. Beth, I'll also include my email on the information that I send to you. And it has just been a joy to talk to all of you guys and your investment you have in your child's life and yourself. And hopefully we all have a little bit less fear to go try work.
Thank you so much, Kelly. This has been very informative and clear, and certainly it's complicated information, and the clear way in which you've addressed it, I think, has been helpful. And I want to, after formally thanking you, and thank you for making yourself available for folks' questions later. And I am certainly also happy to funnel any questions or need for information to Kelly. I want to make an announcement quickly before we have to end the webinar that our final webinar in this series, and Kelly alluded to this earlier, it is a webinar about Medicaid waivers presented by Adam Tucker, who's with the Colorado Department of Healthcare Policy and Finance. He is going to present some general information about Medicaid waivers, but then also some very specific information for participants who are from Colorado. And it certainly is another complicated area. And we can always, I believe, use clarity and information about it. There are also changes happening almost as we speak, it seems, that address Medicaid waivers. We are postponing, though, that webinar. It was originally scheduled for Thursday, October 11th. Due to some conflicts that the presenter had happen, it's going to be on Thursday, October 18th at the same time from 12 to 1 p.m. And if you've already signed up for that, we'll be getting you information about the changes as well. And I see there are a couple more questions here, and I'm looking at time. Kelly, just very quickly, if you're still there, let me read.
Right here.
Are there legal or advocacy groups that can work with them if Social Security becomes a barrier? And I can say that PEAK and PEAK's parent advisors can certainly help you with that. Kelly, I don't know if you have a additional response to that.
So I would obviously send them to you first, Beth, to the PEAK Center, since that's really, a really good place to start. Unfortunately, sometimes it takes multiple times to apply for Social Security benefits. And at times, some parents or families have chosen to get a disability lawyer involved. So please just don't, kind of get fed up with the system, advocate for your child and just continue to apply. But I would definitely refer you back to the PEAK Parent Center for additional resources that they would have.
Great. Thank you, Kelly. And I will address that question in our follow-up email as well. Thanks again for your time, and thank you to everyone who was on the line today. We appreciate your participation. We encourage you to stay connected with PEAK as a resource and with PEAK's RSA Shift project as well. This webinar today was co-sponsored by our Parent Training and Information Center and the RSA Shift project. So we will close. Thanks again, Kelly, and I hope everyone has a wonderful day.